Welcome to CAPS Talks. My name is Dr. Carla Mayorga. I'm a licensed psychologist at FIU CAPS. This segment is going to cover how to manage anxiety, in particular when it escalates to intense fear and panic. And a panic episode or a panic attack is when you have at least 4 of the following symptoms, along with the intense fear. It can be heart palpitations, shortness of breath, either feeling hot flashes or chills, dizziness, either tingling or numbness in the fingers. It can also be a feeling of disconnection from yourself or from reality. This is such an intense physical episode that often people think they're having a heart attack or a stroke and they go to the ER. So today we're going to cover how to manage these episodes. The first thing you can do is do prolonged exhalation, or PE for short. So what you're going to do is inhale normally and exhale as slowly as possible, counting typically from 1 to 4, then hold at the exhale. Before inhaling, hold for at least 1 count, if not up to 3, and inhale again. And you're going to do this 10 to 15 cycles. We'll do 2 right now to practice. So inhale normally and then exhale super slow through the mouth or nose. 1, 2, 3, 4, and hold for at least 1 count. Inhale again, and then exhale 1, 2, 3, 4, and hold. And you're going to do this 10 to 15 times. The reason this works is that the slow exhalation signals to the brain there must be no threat. There must be no actual or perceived threat. And so the parasympathetic system kicks in and shuts down the fight or flight response. So basically, it induces physical calm by sending a signal to the brain that everything's okay. So another thing you can do is more cognitive. So really focusing on your thoughts. So you can think to yourself, for example, this is going to pass. I'm going to be okay. And you can have maybe a mantra that you can choose that's really comforting and reassuring, and just play that on loop in your head as the panic subsides. That can be helpful as well. Some people ask, can I do both at the same time? Sure, of course, you can. Typically, if one is feeling very panicky, maybe they can only do one thing at a time, but you can do whatever works for you. You can do a combination of these or just one. There's 2 more things you can try. So if you want to shut the world out during the episode, you can close your eyes and as vividly as you can, picture a relaxing place. It could be an imaginary place, a real place you've been to. For example, if it's the ocean, you can picture the rolling waves, your feet in the sand, the warmth of the sun on your skin, and you can bring anyone you want along with you, someone typically who would be comforting, a comforting presence, or you can be by yourself, whatever your preference is. Another way to manage an episode of panic is you can do what we call grounding, and there's 2 versions. You can literally pick anything in your sight, and like a painting, and describe it in detail. And that will bring you to the present moment and ground you to the here and now. Another thing is what we call the 5, 4, 3, 2, 1. It's basically the 5 senses. Same idea using the 5 senses. So you can, wherever you are, inside or outside, you can name either to yourself or out loud 5 things you see, 4 things you can touch, like my laptop, my table, my phone, my notebook, 3 things you can hear, right? 2 things you can smell, and 1 thing you can taste. And so that will help to ground you in the here and now. So it really helps with that feeling from disconnection from yourself or from reality. So if you find that panic symptoms are occurring frequently or affecting your functioning in any way, we do recommend that you come to CAPS or call our main line, 305-348-2277, to get an evaluation and see if further intervention is necessary. So thanks again for joining us.